Well, good afternoon, everyone. Thank you for joining us today. Just going to start with a little introduction, and then I'll be turning my screen off just so you can focus more on the slideshow than on me. But my name is Michelle McCullough, and I'm a physical therapist. I work at North Kansas City Hospital. I've been with the hospital for 27 years. I currently am working in the outpatient setting at our satellite clinic off of North Oak, but I've worked in all areas of the hospital during my time here, including home health and actually working in the hospital itself. Okay, I'm going to turn this off now and we'll continue with our next slide. So today I'll be talking to you about how people with long haul COVID symptoms can improve their strength and endurance, as well as how to help manage some other symptoms that we'll talk about today too at the end, such as fatigue and dizziness. So our objectives for today will be to talk about the definition of post-COVID long haul syndrome, or PASC is what I'll be referring to the syndrome for today during the presentation. So that is post-acute sequelae of SARS COVID. So that's where the PASC comes from. So today I'll be referring to this syndrome as that through the remainder of the presentation. We're going to talk about the symptoms of PASC and then ways to help improve your strength and endurance for patients that have PASC, as well as those other symptoms that we talked about as well. Okay, so next slide. All right, so we're going to start with the definition of PASC. Basically, this definition is still in progress. There's still obviously a lot of research going on in this area, so things are constantly changing as we learn more about COVID. So basically, some of the statistics that they feel are probably on the low side, just because initially when patients first started getting COVID, there wasn't a lot of testing available for a lot of people. So a lot of the definitions of this go to people that have an official diagnosis of COVID. So some patients aren't captured in this data, but they're trying to work on doing that. So currently the definition that they're working with are patients that have been diagnosed with COVID and continue to have symptoms for 28 days after their initial diagnosis. So this can be one symptom, not multiple symptoms, but just symptoms, but symptoms that continue for 28 days after. So in the current research, again, because they're dealing with patients that have actually been diagnosed with COVID, they think that approximately 10% of patients that have had COVID end up having this PASC syndrome. However, they feel like that's a low number and that could actually be closer to 30% of patients. That being said, for patients that have been hospitalized with COVID, up to 50% of those patients are being shown to possibly have these PASC symptoms for up to 1 year. Okay, next slide. All right, so let's talk about the symptoms of PASC next. The most common symptoms that we're finding are fatigue, which is the leading symptom, continued cough, breathlessness or shortness of breath, arthralgia, which is just joint pain, difficulty concentrating or brain fog, as people would describe it, difficulty sleeping, continued problems with chest pain or tightness, olfactory dysfunction like the taste smell, and headaches. So with these common symptoms, other possible related medical issues that can occur are ongoing difficulties with your respiratory system or your lungs, sometimes difficulty with the cardiovascular system, so circulation or possible arrhythmias, musculoskeletal concerns such as weakness, and other things like mental health, neurologic components, or even involvement with your kidneys. So these symptoms aren't specific to any population of people diagnosed with COVID. They can affect patients that have no symptoms or patients that had mild symptoms or were in the ICU with COVID. So any of these symptoms and this PASC diagnosis can occur with any patient that's been diagnosed with COVID. Okay, next slide. So our focus today is going to be talking about the musculoskeletal system and the weakness that comes along with PASC, as well as the decreased aerobic capacity or endurance, which also goes along with fatigue, which we'll talk about as well. And then at the end, we will touch a little bit on dizziness, headaches, and pain. Okay, next slide. Okay. So we're going to start talking about strength, and we're going to talk a little bit about what weakness is and then how we can go about gaining strength as we're dealing with PASC. So next slide. All right, so what causes loss of muscle? Research shows that 2 to 3 weeks of inactivity or even just a decrease in your normal daily routine because of an illness can result in decreased strength. Also, if there's no activity, so if you're bedridden for up to a week, so our patients that are in ICU with a severe form of COVID can actually lose up to 2 pounds or up to 11% of muscle loss within a week. So this applies to, again, not just patients that maybe had some difficulties with other comorbidities prior to being diagnosed with COVID, but this can be patients that were healthy before. Our muscle loss can occur fairly quickly and can last. Now, that being said, for patients that aren't in as good as condition or maybe have those comorbidities, the percentage of muscle loss or the impact on that can actually be greater for those patients. Okay, next slide. So some statistics on muscle loss that are interesting. This has to do with patients that have been in the hospital. So some research has shown that new walking dependence can occur in up to 59% of older patients who have been hospitalized. And that would be taking a patient that was doing well before and maybe needing assistance with walking or now possibly needing an assistive device. Another study has shown that 65% of patients have a significant functional mobility decline by day 2 of their hospitalization. And still another study, 27% of patients in the hospital have been shown to still be dependent with their walking 3 months after their discharge, which again could just include them requiring assistance or requiring an assistive device. So as you can see by talking about this, muscle strength you can lose that quickly, and it can have lasting effects on your mobility even months after being in the hospital. Okay, next slide. So what is muscle? Muscle is tissue in our body that's built for power, not just to help us sit up or be able to walk or run or jump, but also to help move blood and body fluids through our system. Our body has about 600 muscles. 2 of the main types of muscles are smooth muscle, which we don't control ourselves. Our body takes care of that. An example of that would be our stomach muscles to help aid with digestion. Then we have skeletal muscle, which is under our control, which we would think of as like our leg or our arm muscles. So we have those muscles and then the tendons attached to the bone, and we actually think about that and are able to get those body parts to move. However, sometimes people don't consider with skeletal muscle that it also includes the muscles in our throat that we use to help with swallowing, and also our muscles that we use to help control eye movement. In addition to the smooth muscle, that also includes muscles that help or aid with circulation and digestion. So when we talk about people losing muscle mass or losing muscle tissue by being weak in the hospital, recovering from COVID, that can also affect things like our vision or our ability to swallow, in addition to the things you think of as far as getting up and just being able to move around and do your daily routine. Okay, next slide. So how do we build muscle? Generally, what we think of in building muscle is we apply a resistance to the muscle, and then that helps to build it. But how does that actually work? So this is called anaerobic activity as opposed to aerobic activity, which we'll talk about a little bit later. So with this, you think about, for instance, lifting a weight, targeting a certain muscle group, such as bending your arm. When we lift that weight, we're actually breaking down muscle cells. When those muscle cells break down, then our body sends in protein synthesis cells and growth hormones to come in and help to repair those muscles that are fibers that are actually traumatized by lifting that weight. But that's what we want them to do, because then they come in, they do their thing, and then the end result is that our muscles come back a little bit stronger each time. So that's kind of the process. Okay, next slide. All right, so how does someone go about trying to gain their strength after being diagnosed with PASC? So first of all, you don't need to spend all day at the gym every day, and we don't want you to do that. There's a fine balance here between doing enough to start building some strength, but doing too much and continuing to keep yourself possibly pain, fatigue, and ongoing weakness. So what we recommend is starting with 2 to 3 times a week, working on 1 set for major muscle groups and working up to 12 repetitions with that particular exercise. So you may only be able to start at 2 or 3 repetitions, and then the goal would be to work up to 12. You want to spend about 20 minutes max doing these exercises and not more than that. What we really want to try to avoid is overusing those muscles initially and causing injury or further fatigue. So we do this by not overtraining and really focusing on the duration of our exercise and possibly the frequency, and trying to increase that before increasing the intensity of the exercises. So that being said, it's also very important for the 2 to 3 times a week that we don't do these exercises 2 days in a row. We just talked about how our body builds the muscle, and it needs that day in between for that to happen, to be able to repair those fibers. So if you continue to exercise multiple days in a row with resistance, you can actually prohibit that from occurring and then kind of stay in that state of pain and not really getting the full benefit from it. So how soon do you see results? Basically, that protein synthesis we talked about for building those muscle fibers can occur within 2 to 3 hours of actually completing the activity. But based on your body size, composition, the hormones in your system, comorbidities are the keys to how fast you'll show a change. Basically, those muscles start showing a change right away, but it may take a little bit of time, for some longer than others, before you see a change in your daily routine or your daily strength. Okay, next slide. All right, so how do we kind of have a little bit of a guideline, but how do we go about getting started? So just like your car, if it sits outside and it's cold, you want to turn it on and warm it up before you get it to run, to help it to run a little bit better. So that's what we need for our muscles too. We need to warm them up a little bit before we just jump into adding some resistance and working on this strengthening process. So what we recommend for a warm up is, depending on your level of activity and how sick you were from COVID and how you're doing now, walking for just about 5 minutes, or even just sitting and working on moving your arms and legs through a little bit of range of motion, warming those muscles up. In the beginning, this might be all that you can tolerate. That 5 minutes of warm up may be it for your resistance. Just like the next little statement says, basically just the weight of lifting your arms and legs may be enough initially to give you a little bit of a workout, and that is just fine. So starting with the warm up, once you're able to tolerate that, then you can start light. So again, you may just be working up to that 12 repetitions for those major muscle groups, just lifting the weight of your arms and legs. Once you're able to tolerate that, then we would recommend starting just with a 1/2 pound to a 1 pound weight for those same muscle groups, working up to the 12 repetitions. Once those 12 repetitions are easy, then you could increase, but just by another 1/2 pound to a pound. Again, we're trying to avoid the overtraining, working on the duration of the exercise versus the intensity first. Something else that you need to think about is using controlled movement. So if you're working up to that 12 repetitions, you need to have good posture, you need to have good form, avoid swinging the weight, making sure you're able to breathe in and out and not strain too much while you're doing the exercises. So really focusing on that as well. You may have some muscle soreness and fatigue that can last the first day or two. That's completely normal. But if you're noticing after you do your exercises that you continue to have some fatigue and soreness that lasts for several days afterwards, like maybe 4, 5, 6 days, that probably means we're doing a little bit of overtraining, and we either need to cut back or the weight or the repetitions at that time. Okay, next slide. All right, so what are some of the muscle strengthening or muscle groups that we're talking about? So basically targeting those larger muscles of your arms and your legs. So just some examples of things would be mini squats, standing at your kitchen counter so that you can hold on for those, and it doesn't have to be deep. Performing a sit to stand repetition from a sturdy chair. Working on push-ups against the kitchen counter or a wall. Working on little mini lunges or step-ups on the stairs. Or if that's a little too much for you at the beginning, really just sitting and working on moving your ankles up and down, kicking your legs, working on some marching, or sitting and reaching up, bending, straightening the elbows, and working on some hand squeezes. Okay, next slide. Okay, so we're going to focus now away from the strengthening component and focus on how to improve our endurance. Again, we want to work on that strength and mobility first to get a good basis before we add in the endurance component. So that's why we talked about the strengthening first. You want to have a good basis with that and some strong muscles in order to start working on that stamina. Again, focusing on duration versus intensity. Okay, next slide. All right. So why aerobic exercise for patients with PASC? We talked about the importance of improving strength. Obviously, weakness is a huge component of what can happen when you're recovering from an illness, but why aerobic exercise? So we know COVID affects our lungs for most patients. So aerobic exercise is what helps with that stamina. So that's how we increase the ability of our lungs to expand to help bring in more oxygen that we need. Aerobic exercise helps to rebuild those pulmonary muscles, the endurance with those, again, to help our body be more efficient with that oxygen bringing in. Aerobic exercise also helps us to keep those respiratory airways clear if you are having a little bit of trouble with some secretions. And with all of those things, all of those help us to improve the amount of oxygen that we can take in and deliver those to our tissues, our muscles, our organs, and everything. So that just helps our body to operate more efficiently, and hopefully will help us to decrease our fatigue and to improve our stamina. Okay, next slide. All right, so how do we go about getting started with our exercise prescription for our conditioning? So during your COVID positive phase, so when you're first diagnosed to 7 days after your symptom resolution, we really just want to focus on resting, moving our arms and legs around just a little bit, and just being able to get up and move around our house just to keep our muscles active and from getting stiff and sore. But we don't really recommend a set exercise routine during that time. We're really just focused on building a basis of trying to stay mobile and trying just to perform our daily tasks. Once we get past that 7 days, then we can look into actually restarting or starting an exercise program. Again, we want to start with the strength training that we talked about, functional tasks like walking around the house, doing your day-to-day things. And then once we're able to get a basis for that, we can start adding in aerobic exercise. The aerobic exercise should only be about 5 minutes twice a week at the beginning, which I know may not sound like a lot, but for patients with PASC that are recovering from COVID, we really need to start with this gradual progression to avoid feeding into the fatigue and possibly making it worse. Again, focusing on the duration, building that duration versus the intensity first with a gradual increase. And we'll talk a little bit about how we can break up those minutes through the day too. So if you look at the FIT principle on the slide, basically we start with the 5 minutes 2 times a week. Our goal would be to work up to trying to do 5 days a week of the aerobic exercise, working on increasing that time or duration from the 5 minutes to 30 minutes. Now, this is where 30 minutes may sound like a lot to some patients. So what we can do here is we can just increase the frequency before we increase that duration. So for instance, we can do 5 minutes 2 times a day or 5 minutes 4 times a day to work up to our 30 minutes. Exercise is cumulative. So if we can do that 5 minutes several times a day, we can certainly add those up through the day and then make that our final minutes for our aerobic exercise for that day. Okay, next slide. Okay, so what are some different types of aerobic activities? We really recommend trying to find something that's enjoyable for you. Aerobic activity needs to be continuous, and that's a big thing to take away here. A lot of times people will say, oh, well, I was up around my house for 30 minutes today doing, different things. This needs to be continuous movement. Doesn't have to be fast, doesn't have to be too strenuous. We don't want it to be at the beginning, but something that's continuous. So dancing to music, performing yoga, running, walking around your house during commercial breaks at the beginning, if that's all that you can tolerate, or possibly sitting and doing a stationary bikes. All of those are examples of aerobic activity, and really the focus needs to be on continuous minutes. Okay, next slide. Okay, so let's talk about some guidelines for aerobic exercise, when and how to start an exercise program. Basically, we recommend selecting a time of day where you feel your best. Start with that so that you get the most out of it. Now, if you have to end up breaking up your minutes, then you may need to dedicate time throughout the day to focus on this aerobic exercise so that you can do that 5 minutes several times a day. But really figuring out what your routine is going to be, what works best for you, and then dedicating that time on your schedule for exercise and not replacing it with other things. You want to feel good after the exercise. You may be a little tired, you may be a little bit sore, but your goal is to feel good. So again, if you're experiencing a lot of pain or fatigue for several days after your exercise, then you're probably doing too many minutes or maybe doing it too intensely. Again, we want to start slowly with those 5-minute sessions, even if you exercise prior to getting COVID. This is something we need to take some time. If you're having these PASC symptoms, then that means your body's having some difficulty recuperating from this. So we really need to take that time to gradually increase. Again, we talked about breaking it up through the day, but starting with that 2 times a week. We want to work hard enough to get some benefit from it, but we really want to avoid working too hard and overtraining. So be realistic with your goals, give yourself time to recuperate and to build up. Okay, next slide. So we're going to spend the last little bit here talking a little bit about a few other symptoms that go along with PASC in addition to the strength and the conditioning that we talked about. So next slide. So we're going to talk about fatigue. It's the #1 side effect or PASC symptom that people continue to report. And this isn't unusual, as a lot of viral illnesses tend to have this as a symptom that sometimes people have difficulty managing as they recover from this illness. So fatigue is the difficulty or inability to initiate an activity or the reduced capacity to maintain that activity. The big thing with fatigue, and there's a lot of research out there, shows that resting does not make it better. So it's different than not just getting a good night's sleep. This is something that affects every aspect of your being, mentally, physically, spiritually. So what we want to do here is find a way to help it be better, but resting tends to not make it better. So what does make it better is moderate levels of aerobic and anaerobic exercise, which are the 2 things that we just talked about. So the exercise will actually be something that helps you to manage your fatigue symptoms. Okay, next slide. So some other ways besides exercise that you can help to manage your fatigue: gradual resumption of your daily activities. Don't jump back into everything that you were doing before you were diagnosed with COVID or PASC. Right when you feel like you're able to, that gradual resumption. Energy conservation techniques. Again, if you feel good in the morning, don't do everything in the morning. Still try to pace things out through the day so that you don't overdo and then pay for it later in the day. And then also, if you have a day where you feel especially good, don't try to cram too much into that day initially until you get yourself feeling a little bit better. Again, to avoid that letdown maybe the next day or 2 of not feeling well. We talked about gradual progression of aerobic and anaerobic exercise, the fact that resting does not make it better. And we really recommend talking to your doctor and possibly getting a referral for physical therapy. With this, we gave you some guidelines today to help with initiating strength and conditioning, but we also like to monitor vital signs. We really would like to be able to monitor that oxygen level and that heart rate and keep you within a safe range as you start up an exercise program and as you progress it initially. So strongly encourage that, but hopefully we've given you some guidelines today where you might be able to at least start some things on your own. Really, with the vital signs too, we want to make sure that we're doing enough to get you some benefit, but not too much to make you continue to be fatigued or sore. Okay, next slide. All right, so dizziness. Dizziness is another thing that can occur not just with PASC, but again, like fatigue, after other viral illnesses. So viral infections of the inner ear sometimes can cause an autoimmune attack by your antibodies or immune cells. Again, doesn't happen with everyone, but just something that can occur. These can lead to some inner ear damage and some long-term vestibular complaints. Again, this does not happen with everybody. It's just something that can occur with patients that have had PASC diagnosis. Basically, treatment for this would be to ask to work with a physical therapist that's trained in vestibular disorders. With this, we can do an evaluation and work on accommodation strategies, positional strategies, or environmental adaptation strategies to help you manage your dizziness. Okay, next slide. Headaches is another result of PASC at times, and by looking at the common triggers, you can see why. Dehydration, poor sleep, stress, worry, anxiety, neck pain, overstimulation, all of those definitely could go along with a COVID diagnosis. Not sleeping well, not being able to eat, possibly being dehydrated, obviously being stressed and worried, and then that can cause neck pain or tension, and then just overstimulation to those muscles. So some different treatment ideas for headaches are just to journal what triggers your headaches. If you have a headache, kind of figure out what's going on leading up to that and maybe work to manage those triggers. Applying a cold pack to your head can help reduce the blood flow and sometimes help with that pain. Focusing on your breathing to help bring oxygen, which sometimes it's nice to work on meditation or just sitting calmly to kind of focus on that breathing. Considering professional help if you continue to have difficulties with stress or anxiety. And then again, possibly considering physical therapy if your doctor agrees to help further assess neck pain, muscle tension, and to assist with those relaxation strategies. Okay, next slide. Pain. Pain obviously can be a symptom for many of the reasons we've talked about. When you're weak and you haven't been up moving as much, muscles get stiff and sore. We have down there joints, motion is lotion. And if you don't use it, you lose it. I'm sure you've heard that before too. So when we're ill and not up moving around as much as we are used to doing, our joints tend to get stiff and sore. Also with COVID, for patients that have been in the hospital, they may have had to be laid on their stomachs or in what we call a prone position. And that can often cause some pain to the chest wall area if you're in that position for a prolonged period of time. So treatment for pain, again, physical and occupational therapy can possibly help if you have ongoing issues with pain, really to focus on your posture, massage, muscle length, slow and controlled exercise, breathing and relaxation techniques to kind of help bring that all together for you. But something that you might want to consider if you're continuing to have difficulty with pain is adaptive equipment. We talk about working smarter, not harder. So sometimes having to use a cane or a walker just to unweight a joint if your legs are sore, possible use of bracing or splints to help support joints, or reachers or other aids just to help with activities of daily living. Okay, next slide. All right, so we talked a lot today about some guidelines for helping to build strength and endurance, and then a few other things there at the end: fatigue, dizziness, pain, headaches. Just so you know, physical and occupational therapy can definitely help you with all of those things. Again, I feel like talking to your doctor about that if you're continuing to have issues with PASC and some of these symptoms we talked about, just so we can help work on getting that exercise range where it needs to be to keep you in that moderate level. We would do an evaluation and some objective testing to help really come up with an individualized plan for you and where that heart rate and those vital signs should be to get you the most benefit from it. Okay, next slide. All right, so that is all I have for you today. I appreciate you joining in. I think we're gonna open it up to questions now. And if you are interested, I do have a couple slides with some references on there if you would be interested after this, but I think we can open it up to questions at this time.
Michelle, thank you so much. I got a lot out of the presentation. I am going to go ahead and put out there that if people have any questions watching this video later, they can go ahead and email them directly to me. And then I can go ahead and get those answered. So my email address is shanna@nkch.org. So let's see if we have any questions.
Okay.
And Michelle, again, I am very appreciative of you doing this for us.
Oh, no problem.
It was very interesting to hear the difference, between fatigue and one of the number one things that I hear is, but I'm just so tired, I can't move.
Right.
So I think it's important to focus on, yes, but when you move, you feel better.
Yes, you just have to do it in the right way and not overdo it.
Yes, absolutely. Okay, well, Michelle, I looks like we're good. So if I get any questions, I will definitely forward them on to you, but I want to say thank you again for talking to us.
All right, no problem.
All right. You have a good day.
You too. Thank you.
Bye.